Hello, I'm Kate, a doctor at the University of Southampton. I would like to tell you about a study that helps to improve the treatment of severe asthma. This study is called COMSA, or Core Outcome Measures for Severe Asthma. This study was led by the University of Southampton. When doctors assess whether a treatment is working, they look at what effect the treatment has on patients by measuring outcomes using different tools. For example, a doctor can measure their quality of life, an outcome potentially affected by treatment, by asking the patient to fill in the questionnaire. But the challenge is that doctors often use different tools, which means results of their research can't be compared or combined. We solved this problem by building a core outcome measures set. This is a minimum list of outcome measures that should be used in all future clinical trials and practice. Using the COMSA will speed up the process of finding which treatment works best for each person living with severe asthma. 4 key groups took part in the COMSA study, including doctors, both adults and young people living with severe asthma, patient representatives, people from pharmaceutical companies, and those who make health policies. So, what did we do? First, we looked at which tools have been used in severe asthma research and how good they are. Second, we did a survey among patients living with severe asthma and their carers from across Europe. Then, representatives from the 4 key groups voted for which tools should be included in the COMSA. This is the COMSA set for people with severe asthma. It includes lung function, severe asthma attacks, and regular steroid tablet use. For children and adolescents, the COMSA are completed with an asthma control test or childhood asthma control test depending on the age, and a pediatric asthma quality of life questionnaire. For adults, Asthma Control Questionnaire 6 and a Severe Asthma Questionnaire round up the COMSA. People living with severe asthma have played a key part in developing the core outcome measure sets for severe asthma. This is why, if you are a researcher or doctor, please use the COMSA in your clinical trials and in practice. If you or a person you are caring for has severe asthma, ask researchers whether they are using COMSA when invited to take part in a research study. By working together and using the same tools, we can make sure that in the future we can choose the best treatment for each person living with severe asthma. If you have any questions, please email me using the email address on the screen. Thank you very much for watching.